It's Dr. Buford. I'm here at the rest of the shoulder team. We're just getting started on your left shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. We examined your shoulder before we started, and you had a significant amount of both posterior and anterior instability. Your shoulder would dislocate posterior, and it would dislocate anterior. So right off the bat, we're expecting to have to reconstruct the joint, both front and back. Now, as we look here, we've got a great cannula coming in the front. Everything that you see is magnified 30 or 40 times on the screen. Here's the biceps tendon. It looks fine. As you look down at the biceps anchor, I do not see a slap lesion. That looks normal, so that's encouraging. We'll look up at the rotator cuff, and here's the supraspinatus part of the rotator cuff. And that looks just fine. As we rotate the camera around posterior, this is the posterior aspect of the joint. And this looks fine. I don't see any significant Hill-Sachs lesion, which goes along with this being maybe more of a multi-directional instability type picture. I do see some tearing in the posterior labrum down there. See that? And in the posterior cartilage on the glenoid. So we're going to be placing some suture anchors back there to address that and reconstruct that. And then as we look down the front of the shoulder, I do not see any significant Bankart lesion, just the instability that we noted on examination. So we're going to go ahead and move the camera to the front and get to work starting in the back of the shoulder. I need a shaver. Okay, so now we're looking from the front to the back. So the view is a little bit different. And here we get a better look of exactly what the damage is in the posterior aspect of the shoulder. And this really shows us what we expected to find based on our imaging and your clinical history and exam. You can see this cartilage that's damaged here and how it's loose. And so this is not stable, obviously. And so we're not going to leave it. You can see a little split in the labrum here as well, although the labrum is pretty robust, but you can see a split in it here. I don't really want to remove any more cartilage than I have to. That looks pretty contained right there, so I'm going to stop there. I'll take a rasp and roughen up the posterior capsule here. This rasp has some sharp points on it. You can see it here. And we use this just to gently roughen up the capsule. Like that. You can even work a little bit here where this labrum's torn. You see the split there. Okay, so here's our spinal needle. We use this to check our angle of insertion for our suture anchor. The anchor does not go through the labrum. It just goes right on the edge of the articular surface right about here. We're going to place one down here and place a second one, at least one more above it. But that looks like a pretty good angle. We'll be able to get a second one in here. So we'll show you some more in a minute. Okay, so here you can see our drill guide coming in. We're going to place our first anchor down. I want to pull back and get an overall picture of the glenoid here. So we're going to place our first anchor down about here. And in order to do that, we have to drill the hole, and then we'll tap the anchor down into the bone. Now that's tapped and seated into the bone. We'll unload the inserter, and there you can see the sutures. We'll pull back on the sutures to seat the anchor, just like that. And now we're going to go ahead and crochet in a pincher. Take this pincher. So now we're going to take one of the sutures and pass it to the front. Remember, this yellow cannula that you see is actually the back of your shoulder. Hold this, folks. Sorry. Just pass that to ourselves like that. And now we're ready to make our stitch. Now the stitch is going to be made with an instrument called a suture hook. This particular suture hook is a 45-degree turn to the right suture hook. So here it is. So that turn in it, it's basically a 45-degree turn. It's loaded with a black wire called the super shuttle. The super shuttle, you can see that there. And the way that we do these is we start with our hook right here. I want to see that gray cannula in the picture here. Okay. We start with our hook right here, and then we rotate back. That tells us pretty much where we need to go into the capsule here. Okay. And then we come down. Okay, so now we're pulling back on the shuttle relay, and you can see how it brings a stitch with it. I'll pull slowly so you can see that. There we go. And see how that comes through the capsule over there? That's exactly what we want to do. We'll go ahead and We'll go ahead and take our pincher tool and do the same thing with the second stitch. Real quick. Okay, so we got the first suture tied. I tied that as a simple stitch because it's a little bit stronger, and in that part of the shoulder I want to make sure we have a good fixation point for the labrum. Now we're going to deal with this area right above. I'm going to take a little punch first and see if I can't make a little hole. Okay, so we're going to go ahead and take this instrument and make some little holes in the subcondylar bone right here. Not a lot, just a few. One. Two, maybe only room for two. I'm going to put an anchor there, so I don't want to mess with that. That out. Next we'll put in our drill guide. Okay, so we've tied the second mattress stitch. You can see it there, and you can see what we've tried to do. That's a relatively small contained defect contained by the labrum, and I've placed some little vascular access channels in it, if you will. Hopefully we'll get some stem cells or some marrow elements to come out and create some healing there. But that's it for the back of the shoulder. We're going to have a look down the front. We may be done, but we're going to certainly have a look down the front and see if there's anything to do there. We may be done. Okay, so we're looking down the front. We've switched our gray cannula to the back. We've got a switching stick in the front. Really, we're using it as a probe. So a couple things to note here. A, the labrum looks normal. The articular cartilage on the anterior edge of the glenoid looks normal, and there's no signs of any labral detachment. Number two, things are pretty tight now that we've tightened up the back of the shoulder, which is a really good sign. And as we were expecting or suspecting, your direction of instability was posterior. But now as we look down the front, I don't see a way to put a stitch in there because things have really tightened up nicely. Okay. So as I hold back this anterior capsule, I think that's good. And we know that you don't have a slap lesion. So I think we're done with our 2-anchor repair in the back of the shoulder. Here's the posterior aspect of the supraspinatus. That looks good. And I think we'll just close this posterior capsule and be done with it. So here's our spinal needle coming through the capsule here. We'll pass our PDS suture through. So there you can see how that stitch goes through. Now we're going to pass a stitch on the other side of this posterior portal. We're just closing this hole in the posterior capsule since that was the primary direction of your instability. So we'll put a little stitch here, and that's going to close that up just like that. See how that works? Okay, recording. Okay, so there's our stitch across the posterior capsule right there. We're just going to tie that outside the shoulder. You can watch on the screen as we tie it, make sure it looks good. I'm happy with the way that looks right now. This one stitch is absorbable, the other stitches are not absorbable. Okay, so we're going to finish up here and get you back to the recovery room in just a few minutes. I really hope this does the trick for you. Good luck to you now. Bye-bye.